shouldering that burden.
Steve Nielsen tonight on our state's aging prison population.
Angela Watson couldn't wait to tell me about her fiance.
He's the sweetest man on the earth.
She doesn't have any photos other than the one in a prison uniform of Robert Younger because the couple met while homeless and addicted. Their lives changed when Angela says Robert sold meth to an undercover cop in 2016.
He was just sadly an addicted man who saw an opportunity to maybe get something for himself and, thought the better of it later, but went ahead and they caught him.
The prison paperwork says he'll get out in June, but at 55 years old, Angela says his medical problems behind bars have grown.
He had problems with his stomach. He found out in prison it was diverticulitis, which is pretty serious. It's pretty painful.
You can add depression and insulin-dependent diabetes to the list. Because it's happening in prison, all of it is costing taxpayers. Every shot, every appointment, every checkup and medication costs the state.
He's had 2, emergency room visits. What is that costing the state of Arizona?
It's a good question, and one that's becoming more important to the state's bottom line every day. The portion of inmates at state prisons 55 and older has increased nearly a full % every year since 2018. Then it was 10.4%. Now, 13% of state prisoners are in the highest age category.
The older the population, the more expensive they become, because people age in prison about 10 years faster than they do in the general population.
Rombach Institute Director Michael Polakowski at the University of Arizona says already the state's prison system is expensive. A look at the governor's proposal for the next fiscal year reveals of the state's $12.3 billion budget, the third largest portion, or 10%, will go to prisons. Polakowski says the percentage will only go up, and prisoners 55 plus cost more than double an average inmate.
Because everything is supposed to be provided for them by the state now that they're incarcerated by the state.
The Arizona Department of Corrections, Rehabilitation, and Reentry said in a statement, currently all inmates have access to chronic care clinics, prescription medications as deemed necessary, specialty clinics on and off complex, as well as assistive equipment. Polakowski said the reason the population is skewing older is because of truth in sentencing laws passed in the 90s.
Truth in sentencing required that every inmate serves 85% of his sentence. And in doing that, we're holding on to prisoners longer. Other states have found that unworkable and have changed their mandatory sentencing. We have not.
Supporters of truth in sentencing say it prevents crime by keeping criminals behind bars longer. It also provides certainty to victims to know how much time will actually be served in prison. As the prisoners get older, the medical conditions mount. According to the state data, of all 37,000 inmates, more than 4,000 prisoners have a medical score of at least 3 or worse. That means at the minimum, they require special housing or reasonable accommodations. The Department of Corrections added, we have ADA-compliant beds and living areas for those with physical limitations and specific housing for those with recurring medical needs.
Prisons are not built like nursing homes, yet many elderly people in prison need walkers, canes, wheelchairs. So you have accessibility issues.
Molly Gill spoke to us from her D.C. office representing Families Against Mandatory Minimums, or FAM. She says Arizona and Iowa are the only 2 states that don't have a compassionate release system for prisoners.
If you can move some of these elderly and ill people out of your prison system, you can put them into the community where their family may be able to pay for their health care, or where they can go on Medicare, for example, and then the state and the federal government are splitting those expensive costs of their health care.
Arizona does offer medical clemency, but it requires the governor's approval, and it can only be used by prisoners weeks from death.
He's getting psychiatric care. He's getting chronic care in prison.
Angela is happy Robert will get out in June, but had hoped it would be earlier.
If he were out and he had the access plan, he would be able to go to an internal doctor to be able to right away get on the right kind of medications and diet.
And she says the taxpayer health care costs of older prisoners is adding up.
It is really affecting everyone, not just me.
Steve Nielsen, Fox 10 News.
Tomorrow on Fox 10 News at 9, Steve with part 2 of his investigation into the aging prison population in Arizona. He sits down with state lawmakers who are looking to add incentives to get prisoners out earlier.